If you are over 60 and looking for a way to say goodbye to sciatic nerve pain in just 5 minutes, you are in the right place. Have you ever wondered why, despite all the stretches and exercises you try, that stabbing pain in your leg keeps coming back just when you thought you'd finally beaten it? The truth is, for many of you, the real issue might not be a slipped disc at all. There is a hidden connection that mainstream medicine often overlooks, a specific mineral deficiency that is silently weakening your connective tissues and leaving your nerves vulnerable to damage. Imagine for a moment the frustration of waking up every morning with that burning sensation or numbness radiating down your leg. It's an exhausting cycle that limits your freedom, prevents you from playing with your grandkids, or simply stops you from enjoying a quiet walk in the park. If you feel trapped in this loop of chronic pain, I want you to know one thing: it's not your fault. It isn't that you aren't working hard enough on your physical therapy. It's that you're likely fighting the battle with the wrong tools, because a fundamental piece of the puzzle is missing. What is this secret that most doctors never check during a routine visit? What if I told you there is an essential trace mineral that, when missing, makes it nearly impossible for your discs to heal, no matter how many rehab sessions you do? Today I'm going to reveal a scientific link between sciatica and a nutrient deficiency that could change the way you understand pain forever. I've spent significant time researching why certain treatments consistently fail senior patients. What I've discovered by synthesizing clinical data is that the most effective solution isn't found in a new stretching routine, but in a fundamental element that builds the very structure of your body. In this video, I've packed everything you need to move from temporary fixes to lasting recovery. In the next few minutes, we will explore together how your sciatic nerve actually functions and why the structure of your discs depends on a very precise chemical balance. I'll show you how this deficiency can mimic the symptoms of a herniated disc, and more importantly, what concrete steps you can take today to reverse the trend. Before we dive into this discovery, I'd love to know where you're watching from and what your age is. Drop a comment below. Reading your stories helps me create content that serves you exactly where you are and helps our evergreen seniors community grow. If you want to keep receiving science-based tips to live your best life, make sure to subscribe and hit that notification bell. Let's start by clarifying what sciatica actually is. It is a problem involving the sciatic nerve, which isn't just any nerve, it's the longest and largest in the entire human body. To give you an idea of its size, look at the width of your thumb. That's roughly the thickness of the nerve where it exits your lower back and sacrum. It is formed by 5 different nerve roots working together to send movement and sensation signals to your legs. When one of these roots is irritated, the whole system goes haywire, which is where that familiar pain begins. Now, let me share something important. There are wonderful stretches that can give you immediate relief, and I absolutely recommend them. But the real problem is what happens a few hours later, or the next morning, when that dull, irritating ache comes right back. Why does this happen? Because we are merely silencing the symptom instead of fixing the root cause. About 90% of the time, sciatica does involve a disc, but have you ever thought about what makes a disc fragile enough to fail in the first place? To understand this, visualize your discs like jelly donuts. They have a tough outer layer and a soft inner core. When that outer part weakens, the inner gel can squeeze out and put pressure on the surrounding nerves. This results in buttock pain, burning down to your foot, or that deep, annoying sensation of irritation. But here is the critical point. What if the material holding that donut together is literally vanishing because of something you aren't eating? There is a specific condition, often confused with simple aging, that could be the real culprit behind your suffering. This condition that caught my eye is called Myelo-Neuropathy. It's a bit of a mouthful, but let's break it down. Myelo refers to the spinal column and the nerves running through it, while neuropathy simply means nerve damage. Essentially, it's a double hit, where both your central spinal system and the peripheral nerves branching out are struggling at the same time. This isn't just a minor ache. It can manifest as intense burning, deep gnawing pain, numbness, and even muscle weakness, because your nerves can no longer communicate effectively with your muscles. Now, here is the revelation that could change your life. The vast majority of the time, this debilitating condition is caused by a copper deficiency. While deficiencies in vitamin E or folate can play a role, copper is usually the missing link. When I started connecting the dots between copper and the sciatic nerve, the results were staggering. We often think of copper as just something used for pipes or pennies, but in the human body, it acts as a high-performance conductor for electrical signals and a master builder for your structural integrity. Think about the products already on the market that people swear by. Copper-infused bracelets, creams, patches, and hip braces. Thousands of people, many of them huge skeptics, report incredible relief when they apply copper topically near the origin of the sciatic nerve. While the scientific community is still catching up on exactly why this works, whether it's absorbed through the skin or helps rebalance the electrical fields in your painful joints, the real-world results are hard to ignore. Even the ancient Egyptians used copper jewelry to combat inflammation and arthritis. You might see some major health organizations claiming there's no validity to these copper products, but I've learned that when a low-risk, inexpensive solution is dismissed, despite massive public success, it's usually worth a closer look. I'm not going to wait decades for a perfect clinical trial when we have a non-toxic option that might help you walk without pain tomorrow. But as helpful as a copper brace might be on the outside, the real magic happens on the inside. Why is copper so vital for someone suffering from sciatica? It all comes down to enzymes. One of the most critical roles copper plays is serving as an essential cofactor for building collagen and connective tissue. If you remember our jelly donut analogy for your spinal discs, here is the kicker. Your discs are made of collagen. In fact, about 75% of that tough outer layer that keeps the gel inside is pure collagen. If you are low on copper, you are essentially trying to build a house with weak, crumbling bricks. Without enough copper, your collagen production falters, making your discs brittle and much more likely to bulge, herniate, and crush that sensitive sciatic nerve. It's a structural failure caused by a nutritional gap. But the damage doesn't stop at the discs. Copper is also required to maintain the myelin sheath, the protective insulation that wraps around your nerves. When that insulation wears thin, your nerves become hypersensitive, firing off pain signals at the slightest touch. Does it feel like your body is just wearing out? It might actually be that your body is missing the raw materials it needs to repair itself. And as we dig deeper, you'll see that this deficiency doesn't just affect your back. It could be the reason behind your carpal tunnel, your fatigue, or even why your hair is turning grey faster than you expected. But how did we become so deficient in the first place? And what does it have to do with the healthy habits you might already have? So how does a person over 60 end up with a copper deficiency in the first place? It's more common than you might think. The first reason is simply our modern diet. The foods highest in copper are shellfish and organ meats, two things that most people rarely eat anymore. But even if you're eating well, other healthy habits could be working against you. For example, if you've been taking high doses of zinc to boost your immune system, you might be accidentally depleting your copper levels because these two minerals compete for absorption. It's not just zinc either. Taking too much iron, or even high doses of vitamin C in the form of ascorbic acid, can push copper out of your system. If you're an active senior who enjoys intense exercise, your body's demand for copper increases significantly to keep up with the strain on your red blood cells and connective tissues. Even common daily habits play a role. Drinking tap water with fluoride, consuming too much sugar, or relying on coffee and alcohol can all drain your copper reserves. For those over 60, the challenge is even steeper. As we age, our digestive systems produce less stomach acid, which is essential for breaking down and absorbing minerals like copper. You might be eating the right things, but your body just isn't getting the bricks it needs to repair your spinal discs. Plus, many of the medications commonly prescribed to seniors can interfere with how these minerals are processed. But here is the most fascinating part I found during my research. It might be in your DNA. Some people have specific genetic mutations, known as polymorphisms, that make it much harder for their bodies to absorb copper. If you have these genetic markers, you could be facing chronic sciatica and carpal tunnel syndrome, even if your diet seems perfect on paper. This is why some people struggle with age-related disc degeneration much earlier or more severely than others. It's not just bad luck, it's a lack of structural support at the cellular level. Think about your spine like a bridge. If the steel cables your collagen start to rust and snap because they lack the right protective coating, the whole structure begins to sag. No amount of stretching the bridge is going to fix those cables. You have to provide the copper to rebuild the strength of the system. But before you run to the store, you need to know exactly how to use this information safely, because balance is everything. In the next section, I'm going to break down the specific action plan to fix this, including the exact dosages and the specific foods that can act as medicine for your nerves. But first, let me ask you, have you noticed other signs of low copper, like premature grey hair or feeling cold all the time? The answer might be more connected to your back pain than you ever imagined. Now that we understand the why, let's talk about the how. What can you actually do to fix this? After reviewing the data and looking at successful patient outcomes, I've narrowed it down to 3 practical options to help you rebuild that structural integrity. First, consider the external approach with a copper-lined brace. Look for a brace specifically designed for sciatica that wraps around the hip and upper thigh, right where the nerve exits the lower back. Many seniors find that these braces, along with copper creams or patches, provide a noticeable layer of relief while they work on the internal issues. It's a low-risk way to manage the daily grind. Second, let's look at your plate. Food is your primary medicine. If you want to increase your copper intake naturally, the absolute best sources are beef liver, oysters, and other shellfish. If those aren't to your taste, dark chocolate, the kind without the added sugar, along with cashews and grass-fed beef, are excellent alternatives. These foods provide the biological building blocks your discs have been starving for. The third and perhaps most vital step for many is targeted supplementation. This is how you truly move the needle if you have a significant deficiency or a genetic absorption issue. My recommendation is a step-up protocol to avoid any digestive upset. Start with just 2 milligrams of copper per day. Every few days, slowly increase that amount until, over the course of a month, you reach a therapeutic level of 20 milligrams. I know 20 milligrams sounds like a lot compared to a standard multivitamin, but remember, we aren't just maintaining health. We are trying to repair years of collagen depletion and nerve damage. Think of it like a loading phase for your body's repair crew. You'll likely stay at this higher level for about a month to give your discs and myelin sheaths the surge they need to start healing. However, you must stay tuned to your body's signals during this process. If you feel any stomach discomfort, simply slow down the pace of your increase. And most importantly, you have to understand how to transition back to a maintenance dose, so your minerals stay in perfect harmony. In the final part, I'll explain exactly how to balance this with other minerals like zinc, and how to combine this nutrition with the right movement for a pain-free life. But first, are you ready to see how a simple adjustment in your mineral balance can make your stretches 10 times more effective? After 1 month at the higher therapeutic level of 20 milligrams, it's time to find your long-term balance. You can begin to gradually reduce the dosage and monitor how your body responds. If you feel great, keep tapering down. If that familiar ache starts to creep back, you may need a slightly higher maintenance dose for a while longer. Over the course of 3 to 4 months, many people find their sweet spot at a simple maintenance dose of 2 milligrams a day. The goal here is to give your body the sustained resources it needs to keep that tire, your spinal disc, strong and fully inflated. But there is one final crucial rule for mineral safety. You must keep your copper and zinc in balance. Usually, for long-term maintenance, a ratio of 1 part copper to 10 parts zinc is ideal. While you are correcting a major deficiency, you might prioritize copper, but eventually, you'll want a high-quality multi-mineral or a combined supplement to ensure your system stays in harmony. I want to be very clear. This copper connection doesn't mean you should stop your physical therapy. You should still perform your daily stretches to maintain flexibility and relieve immediate pressure. Think of it this way: the stretches give you relief today, but the copper provides the healing for tomorrow and prevents the pain from returning. When your nerves are properly insulated with a strong myelin coating, they become less sensitive and far less likely to send those agonizing pain signals, even if there is minor compression. I've seen patients who struggled for years, trying every pill and every exercise without success, only to find that their sciatica vanished once they gave their body the building blocks it was missing. It's about more than just pain. It's about reclaiming your life. Before you start any high-dose regimen, please check with your healthcare provider, especially if you have existing conditions or take other medications. Here is your final action plan. Evaluate your risk factors. Try a copper brace for immediate support. Increase your intake of liver or shellfish, and consider a gradual copper supplement protocol, starting at 2 milligrams. Be patient with yourself. Rebuilding collagen and repairing nerves takes time, often several weeks to a few months to see the full transformation. If you found this insight into the root cause of sciatica helpful, please give this video a thumbs up and share it with a friend who is tired of living with nerve pain. We are building a community here at Evergreen Seniors dedicated to science-based health, so don't forget to subscribe for more tips designed for your best years. Have you ever tried copper for joint or nerve pain? I'd love to hear your experience in the comments below. I read every single one. Until next time, stay active, stay informed, and remember that your health is your greatest wealth. Reminding you that sometimes the answer to chronic pain isn't just another stretch, it's the simple nutrient your body has been waiting for.